Really happy to have you with us today. Welcome to the National Adoption Competency Mental Health Training Initiative, Transfer of Learning Tuesdays. Today's webinar is entitled Practical Implications for Clinicians. I'm Dawn Wilson, Director of the National Training Institute at the Center for Adoption Support and Education, or C.A.S.E. We're located in Burtonsville, Maryland, but of course, providing services, training in particular across the country. My co-presenter today is Lisa Maynard, and Lisa is one of our implementation specialists with NTI. We're also going to have two other folks joining us a little later on, and we'll be introducing those folks when it's time for them to join. So before we look at today's agenda, I just want to encourage you, if you haven't already, to please introduce yourself in the chat box, your name, state, or the organization that you're with, and just mention a little something that brings you joy. I don't know about you, but for me, spending time with friends brings me joy. So, Lisa, how about you? Oh, you're on mute.
There we go. Something that I've been enjoying since the weather is getting nice here in upstate New York is gardening. Love getting my hands in the dirt. So welcome to everybody. And we've got folks here from Florida and New York City, Indiana, Minnesota, California, Kansas, Texas, Arkansas, Nevada, Tennessee. We've got people from all over the US, and more no doubt will be joining us as we get started here. And some things that folks are saying bring them joy: my son, my family, my work, which always is nice. A couple of people said making a difference in their work brings them joy. Seeing adoptive parents get it and respecting birth parents. I think that's really cool. From Illinois, walking with my dog. In Maryland, walking trails. Oh, that's our Edna, our other implementation specialist.
Fran said listening to live music brings her joy, and I would love to hear some live music.
Oh my gosh, wouldn't that be nice? Traveling. Can we travel soon, please? Yeah, so lots of great things. And in Alaska, cross-stitching. Glad to have you here from Alaska. Can't even imagine what time it might be in Alaska right now. But lots of things that bring us joy in the present moment that we could still do while in this crazy time of COVID that we're slowly coming out of. And some things that we've not been able to do, so probably missing a little bit of joy, the travel, the live music, those kinds of things. And hopefully we'll get to do that again soon. As Dawn said, I'm Lisa Maynard. I'm the implementation specialist, one of the implementation specialists with NTI. And I'm happy to be here and happy to have you here with us today. So just quickly, I'm going to go over the agenda, what we'll cover today, welcome and introductions. That's what we're doing right here. And your sharing in the chat helps people around the country get to see who else is with us. We're going to talk a little bit about NTI, give an overview. And then our guest presenters, Bonnie and Courtney, will be sharing examples and stories of ways in which NTI has impacted their practice and maybe personally as well. We're going to talk about practical implications for clinicians, how this training can support day-to-day practice, and then we're going to talk a little bit about access and implementation options for those of you who don't know how to get ahead in NTI. Okay, and we have somebody from Ireland. Holy cow, that's awesome. Welcome, welcome, welcome. Okay. So today's webinar objectives, we're going to help you understand the value of adoption competency and NTI to improve the adoption competent practice to enhance permanency and well-being for children and families. So some of you may have already heard of NTI, some of you may have taken it, and some of you may be very new to this. So we're going to give you some info about it. We're going to talk about how NTI training and skills and knowledge can be applied in clinical practice? What are the tips and tools that we have that you could take right from the training and use it to implement it with your clients today? We are hoping to demonstrate the benefits to clinicians and mental health agencies and professionals to have staff trained in NTI, in adoption competency. Oftentimes we hear from people that, you know, they know loss and grief, or they know about identity formation, but it's a little bit more complicated when we talk about adoption, and we're going to give you some examples of that. And then we're going to give you some ways to assess the value and relevance of NTI for your practice and your agency, and how to access NTI as well. So we've got a quick poll here. Gary, if you would do the poll. So what best describes your current role? And this is a multiple choice, and you can choose all that apply. So click on the role that best describes your current role or roles. We'll give you a minute or so. And if you're not listed, then please do put that in the chat. All righty, what do you think, Gary? We got people answering? Terrific. Great. So there's a large number of you are licensed therapists or social workers, some clinical supervisors, a couple administrators, child welfare professionals, child welfare case managers, educators, adoptive parents, and other. And so some of you might be filling multiple roles, right? I'm an adoptive parent as well as a child welfare provider and a therapist as well. So yeah, home study specialist, great, post-adoption services, provider for educators, great. We've got a big, nice nurse practitioner, that's awesome. An adoptive mother. Okay, great. So a nice, well-rounded group here. So Dawn, do you want to talk a little bit about C.A.S.E?
Sure, I'd be happy to. So for those of you who don't know, the Center for Adoption Support and Education, or C.A.S.E, was founded in 1998, founded by Kathleen Dugan and Debbie Riley. Debbie is still our CEO, co-founder. And C.A.S.E started out as an organization that provided primarily counseling, clinical services, if you will, to foster adoptive families in the DC, Maryland, Northern Virginia area. And, you know, we're a private nonprofit agency. And our vision really was that everyone touched by foster care and adoption would have access to adoption competent services. So really to help navigate their journey through life. And when we were founded, it was really, really essential that we be an organization that never told a family, in particular an adoptive family, to return their child to the child welfare system, because our founder had had that experience early on. And so we have really taken that to heart, and that really was sort of the basis for our organization and the development of our clinical service delivery. From our clinical service delivery, we grew to provide adoption competent trainings for professionals. We have a training called Training for Adoption Competency, or TAC training, that's available for licensed clinicians. And we have the training we're going to talk about today, which is the National Adoption Competency Mental Health Training, web-based training for both child welfare and mental health professionals. And we also have a host of other trainings that we provide to both parents and professionals, educational materials. We have programs like Wise Up, which is an empowerment resource for families to learn how to respond to intrusive questions. And would encourage you to go to our website at www.adoptionsupport.org to learn more about it. Oh, so I'm still up. So let's talk a little bit about NTI. So um, hopefully some of you are already familiar with NTI. Maybe some of you have taken our training. I know I've recognized some names of folks that we've worked with over the years. So C.A.S.E back in 2014 responded to a funding opportunity from the federal government. This was through the Administration for Children and Families, the Children's Bureau, to be the lead organization for the development of what was considered state-of-the-art web-based training. And this was designed to be training for both child welfare professionals and mental health professionals in order to enhance their capacity to understand and address the mental health, developmental, and other challenges that children and youth in foster care, moving to adoption, or guardianship are experiencing. And this started in 2014. This was initially a 5-year initiative, a $9 million initiative to develop this web-based training. And once the training was developed and piloted in 8 sites, the goal was for us to really spread this training across the country, which is part of what we're doing right now. But really, when we think about like, why was NTI developed? I mean, obviously we wanted to enhance the capacity of the workforce to be able to adequately, effectively serve families. We wanted to support children to heal from trauma and loss. We wanted to provide parents with the skills to parent more effectively. And while this training isn't designed specifically for parents, it's designed to help professionals who are working specifically with parents and youth. And ultimately, it's really about improving child and family well-being to increase family stability. So that's kind of where we are with NTI, and it has been available for this past year, since 2020, nationally. You know, so what do we know about adoption? And this might be preaching to the choir, but we know that for most children, adoption is a significant protective factor, right? It's a wonderful thing for families, for children to be able to have their forever family, or permanent, permanency. But we also know that for a number of children, there are some challenges for them. And through this NTI web-based training, C.A.S.E is looking to support a core of common mental health adoption learning that will enhance the ability of child welfare and mental health professionals to work together, to have aligned curriculum so they have a shared language and a shared understanding about the needs of children and families, to collaborate to better serve adopted children and their forever families. Right. So as I said before, we do know that there are families that struggle. And one of the things we know is the American Academy of Pediatrics has really identified mental and behavioral health as the greatest unmet health need for children and teens in foster care. And we also know that children who are adopted are overrepresented, certainly in higher levels of psychiatric care and other kinds of mental health service delivery. And what's really important, I think, for us is knowing that we can provide a tool that really can help both child welfare professionals and mental health professionals who are serving these families to really have the skills they need, the tools they need, the knowledge, the skills to provide adoption competent mental health services. We've worked to support this collaboration between child welfare and mental health to improve permanency outcomes and to improve the health and well-being of children, both who are in foster, adoptive, and guardianship families, and of course their families. All right, I think Lisa, it's your turn.
Great, yeah. Any questions about what Donna said so far? Feel free to drop questions in the chat box. So let me tell you a little bit about the NTI curriculum. So the training, there are 2 very well aligned trainings. One is for child welfare and one is for mental health professionals. The child welfare training also has a supervisor component. It's an additional 5 hours. So the child welfare training is about 20 hours. And then another 5 hours, as I said, for supervisors. The mental health training is 30 hours with options for coaching sessions. The child welfare curriculum has 8 interactive learning modules, and they're focused on casework practice. The mental health curriculum offers 10 interactive learning modules focused on clinical practice. So that really is the biggest difference. The mental health curriculum is much more clinically focused. The additional 2 modules in the mental health curriculum are on assessment, intervention, treatment strategies, and therapeutic parenting strategies. And there is information in the clinical and the mental health training that talks about evidence-based treatment interventions, as well as lots of different options too. Again, those trainings are those evidence-based treatment interventions are talked about, but this is not a training on, say, EMDR or TFCBT or anything like that. The child welfare curriculum has been approved for 20 NASW Category 2 CEUs, 25 for the supervisor modules, and NASW has approved the mental health training for 25 continuing education credits.
And Lisa, just a point about that's for folks who take the training via our learning management system. We also work with systems to integrate this training into their own learning management system, and whether or not CEUs are available would depend on who that provider is and whether or not they've done that approval process. But certainly through us, we provide the CEUs.
Great, thanks for that clarification, Dawn. People often ask us, excuse me, what's built into the NTI training. This is a list of the modules: understanding children's mental health challenges, excuse me, loss and grief, the impact of trauma on children and families, building strong attachments. We at NTI and at C.A.S.E believe that attachments can be built and rebuilt. Positive identity formation, the impact of race, culture, and diversity, and providing post-adoption supports. So those are covered in both the child welfare and mental health trainings. And the mental health, as I said, has 2 additional modules on assessment and treatment planning and therapeutic parenting strategies. And our website is located down here at the bottom of the screen. And we've got lots of resources, and we'll be sure to make sure that you get this throughout the presentation so that you can see all the resources that we have on our website. We piloted NTI in 9 sites across the United States. And this is a map of where we were. Courtney's going to tell you a little bit about Alaska, and Alaska is not as small as it looks on this map, and I was surprised to learn that. But Maine, Minnesota, Washington, California, Oklahoma, Illinois, Tennessee, South Carolina, and Cherokee Nation here in Oklahoma were our pilot sites. There were about 2,800 mental health professionals across all 9 sites who participated in the training, and 69% of them completed the NTI. Those who started it completed it. The child welfare pilot had over 6,000 child welfare professionals, and about 73% of them completed the training. Those numbers are really, really good. The research shows that completion rates for online training range in the 20% range. So we were thrilled to pieces that we got such great completion rates. We're going to talk a little bit about mental health providers today because that's what our focus is. So again, nearly 3,000 mental health professionals completed the NTI. They included social workers, support workers, therapists, clinical psychologists, psychiatrists. We had some medical doctors, nurse practitioners, and so on. And as I said, about 69% completed who began. This is something that we have found to be really most interesting and really makes the case, we believe, for adoption competency training. These are the pre and post test scores for the mental health professionals. And the blue lines are the pretest scores and the orange are the post-test scores. So you can see here that module 5, 6, and 7 had the lowest scores and the greatest knowledge gains, right? Which is a good thing. That's a really good thing. But to start with, module 5, attachment and child development, only 34% passed. Module 6, race, identity, race, ethnicity, culture, and diversity, 39% completed, passed the pretest.
Actually, Lisa, that was the average score. The average score of all the people who completed was 34 on the pretest. So think about this as a 10-question, quiz, pretest. They got 3.4 questions correct out of 10. And then you can see they got 9.5 questions, on average correct at the post test. So, and we didn't try to make these intentionally hard tests, but across all of our sites, this was the consistent finding that we saw with it. These 3 modules around attachment, race, and identity formation had the lowest scores across all of our pilot sites, and was a little concerning, I think, wouldn't you say, Lisa, for most of our pilot sites?
Yeah, our pilot sites were very surprised and concerned about it. And what does this tell you? When you look at these findings and these test scores, if you think about attachment and child development, and attachment being at the core of all adoption, right? So what does that tell you are the mental health folks that we're sending our kids to, if you work in the child welfare arena, or if you're an adoptive or foster parent or kinship parent, right? Many of the mental health professionals that are seeing our kids really don't have a good enough understanding of attachment and child development to really be useful, to be healing for our kids.
And it's even more concerning when you realize that the average years of experience for the folks who were involved in this pilot were not people with just 1 and 2 years of experience. These were people who had 7 to 9 years of experience in the field providing therapeutic services. So again, they may have been working with families for years, but didn't necessarily understand the specific needs of this population of children in foster care, those working with their adoptive and guardianship families, and how to help them to be, healthy and have well-being and be supported in the ways they needed to be.
Yeah, and I'm going to say that in my time in this in this area, in this field, I've heard therapists for many years talking about children who have difficulty in attaching. And our kids come from hard places, right? I mean, they've got multiple placements, they've got histories of trauma, of abuse and neglect. And more times than I care to count over the years, I've heard therapists say to a family, this just isn't what you got into adoption for. Maybe you should give the child back. And aside from that being just, I'm allergic to those words, it feels irresponsible for a mental health professional to say to a family, you need to give this child back because we just don't have the tools. That's how I would interpret it. We just don't have the tools to help you help your child.
Yeah.
So we're going to introduce our speakers here. Dawn, did you want to do that? Tell us a little bit about Bonnie and Courtney.
Oh, sure. All right. So I think Courtney's going first. So you want to introduce Courtney?
Sure, go ahead.
So hi, Courtney. Courtney Butler is a clinician based in Alaska. And she has completed our NTI training. And Courtney, I'm going to let you tell a little bit more about yourself as you do your presentation.
Yeah, absolutely. I actually was part of one of the pilot programs, I believe. I started it in 2018. And so I don't know if you want to fill in one of the states for the map or not, but we weren't actually one of the sites, but myself and one of my coworkers, we had been part of it. So, But good morning, everyone. It is morning for me here in Alaska. It's only 10:30 here. My name is Courtney Butler, and I'm excited to be here with you today and share a little bit about what I learned from the NTI training and how it helped broaden my awareness and kind of change my practice. I would like to take a moment and acknowledge the land that I'm on. That is something that I've learned about up here. I am on the Inupiat lands today. It is not my land, and so I do want to be respectful of the lands that I'm on today. I am coming to you from Utqiagvik, which is also known as Barrow, Alaska. It's the northernmost part of Alaska. If we want to go to the next slide, we can kind of get an idea and understanding. So Alaska is a fairly large state, as you can kind of see. Barrow to Juneau, Juneau is our capital, is about 1,100 air miles, which would be approximately from New York to Orlando. And as you can tell, Barrow is at the northernmost part of the state. Like I said, we call it the top of the world. And the area that I serve is roughly 95,000 square miles, which is just a tad smaller than the state of Michigan. And so it's fairly large. So just to get you kind of an understanding of where I am coming to you from today. If we go to the next slide, please. I work in a state licensed emergency shelter facility. It's 14-bed co-ed. We take 0 to 18 years. In the almost 5 years that I've worked here, I've only had about 2 clients who were private admission. Everyone else has been in state, tribal, or juvenile justice custody. Some of my clients have been mixed heritage. However, almost all of them have been exclusively Alaska Native, specifically from the Inupiat people. Some of them have Filipino background. Some of them are Tongan, things like that. But most of them have been Alaskan Native. Next slide, please. And being here up at the top of the world, we do have some very unique challenges. We are very isolated. We are not on the road system. We do go through periods of 24 hours of darkness in the winter. We have about 2 solid months of darkness, and then we have about 24 hours of sunlight. And with the isolation, we really the only ways in really are by plane. During the winter, we have an ice road for about maybe about a month or so. And then during the summer, we have barges that can come in for about a month or so as well. We do have a severe lack of mental health resources. And so going back to the size of the state of Michigan, we are the only facility for children on the North Slope, which is kind of what we call, we don't have counties, we have boroughs. And so our borough is the state, basically the size of the state of Michigan. And my facility is the only one that serves children. We do have a sister agency that does outpatient facility or outpatient services. However, they only have about 6 clinicians, I think, right now, if that. And so I'm the only one who really states that I'm a child clinician. And so think about the size of that amount of land and everything, and that amount of people. And there's only this amount of professionals. So severe lack of mental health resources available up here. We're also dealing with a lot of historic trauma. We're dealing with a lot of colonization is still fresh, and a lot of the elders' minds here. And so that is something that we have to be very aware of, the stripping of the religion, the stripping of culture, the stripping of their lands, the stripping of their identity. And then we have a very severe lack of foster families. And so a lot of the placements that the kids that I work with, they are going to kinship and guardianship. And a lot of times it is with white families. And so that is something that I've had to work with as well. And so I know that everywhere, we each individually, wherever we work, has their own challenges and everything. However, I share these just so that you kind of understand where I was coming from when I started NTI. And so if we go to the next slide, for me, when I was studying with NTI, there was 4 major areas that definitely impacted my practice when working with the children as the families as they were going through adoption, kinship, or guardianship placement. I definitely was not an adoption competent counselor or clinician. I will say that. That is definitely something that I was lacking in. And so NTI definitely helped me broaden my awareness about adoption, about development. And so one of the areas definitely is about identity, the child, their self. So a lot of the children that I work with in the culture, they are still very much a hunting and gathering. And so a lot of the children are left in charge of their younger siblings. And so the child as a previous caretaker to their siblings, or sometimes even to their own parent or relative, if they've been involved with substance use or anything like that, it can be hard for them to fit back into the role of a child, especially as they are going into, say, a white family. And so that is something that I've definitely had to work on with a number of the families that I've worked with. One of the families that I work with commented that the 9-year-old that they had adopted didn't know how to play. All they wanted to do is, they were trying to keep care of the house. They were doing dishes, they were doing laundry, things like that. And so it was having to go through and educate a lot of the Caucasian families that are coming up here and adopting on the culture. And then also helping the child begin to develop their self and their identity separate from how they had been and separate from their trauma, and not changing. They obviously had learned some very important skills. I don't want to negate that, but helping them identify themselves differently, helping them reestablish themselves. And then also as their culture, obviously the Inupiaq culture is very different than my culture. It's very different than a number of our culture. And a lot of people struggle with that, and a lot of our kids struggle with that as they are going into this, I would almost say, a new world, as they're trying to rediscover and redefine themselves, and finding themselves in that culture. Because the Inupiaq culture is very, it revolves around whaling, it revolves around the land, it revolves around tight-knit community, it revolves around helping the elders and everything. And I think there's different values and everything that a lot of our cultures as well have, but it's just very different. And so it was something that I had to be very aware of, and also help our families that are adopting or being kinship or guardianship placement for, help them understand spirituality and helping the child identify that. There's a lot of trauma here regarding spirituality as well. We have the white settlers who came in with the religion, who took away a lot of, say, medicine men, who took away and would beat or would chastise, if they had shaman, things like that. And so we do have different villages who still practice those religious practices. However, we have some still who are very Christian based, and who are, the European version of that. And so, you have that clash as well, especially if they come from a village like Point Hope, where the shamanism is still potentially occurring and things. And so you have those two different cult clashes. And then if you have a white family who comes in who isn't very religious, or who does want the child to practice. However, if you've had, they're coming from a traumatized home who potentially religion was beat into them or something. And so it's just very much in terms of helping the child establish their identity and develop it, and helping the family with that communication. So going to loss and grief, open communication. Obviously, open communication is always something that we are always trying to encourage in our clinical sessions. In my clinical sessions, I am. However, it is something that I had to deal with as well in learning with the Inupiaq values. One of their values is avoidance of conflict. And so I had a family that I was working with, who the child was struggling with some of the rules and some of the boundaries that the adoptive family was setting for the child. And, the adoptive family wanted to communicate with the child, but the child was like, I'm struggling with these rules, but, I'm trying to avoid the conflict with my adoptive family, and they're my elders, I'm supposed to respect them. And so working with the child to help the child be able to communicate that as well, but also communicate that they're dealing with the loss and grief. And I changed the name of a child that I worked with, but I had a child who had been removed from an adoptive placement and put back into foster care, and then was placed with another kinship placement. And the previous adoptive placement had been very abusive to this child, and most of the caseworkers and people who had been interacting with the child had been like, oh, that was a terrible place. You should not miss this family. However, when I was working with the child, and what I learned from within NTI is listening to the child and listening to the loss and grief, because for this child, the child still missed this family, even though there was abuse going on, even though there was neglect going on. There was that loss of family. There was that loss of knowing what's going to come next. And so something that I really appreciated was just sitting, that I learned from it with the NTI curricula, was being able to sit with the child and be able to learn that and communicate that with the family. Another thing that I really learned about is that while I lived up here, is we ended up fostering and adopting our own child, Alaska Native child. And it was very eye-opening. And the loss and grief really hit me, because if I had not gone through the NTI program, I think it probably would have wrecked our family a lot more. And this is me getting a little personal, and so I apologize if it's crossing boundaries for some of you. But the loss and grief, the loss of the family for this child, whereas in my head or previously it would have been like, well, you should be so excited because you're gaining a family, and these people treated you terribly, and da 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 da. But they lost their family, they lost this, they lost the future they were hoping for, they lost this and this. It wasn't about everything they were gaining. And so NTI definitely helped me reshape my expectations and reshape how I view things, and it helped me help my husband as well. And so it definitely was something that was it was a very much a growing experience for me. So those two were definitely very important to me. Two other areas that I definitely want to touch on that NTI definitely helped me with was trauma, and I want to talk about privilege as well. And so obviously, like she said, it isn't going to teach you about being super competent in TFCBT or different types of therapy, but reviewing the trauma, reviewing ACEs, reviewing, it definitely has a lot of different assessment tools that you can use with the families. Making sure that we're normalizing behaviors with the adoptive and kinship family or guardianship, whoever the placement is. Going back to my own, looking at that loss and grief. Yes, you expect a child to be so excited because they're in a new place. So why are we having these behaviors come out? This is a completely normal process. And that's something that the NTI program really helped me understand a little bit more. Something that I had never really thought about in the past too is looking at the placement family's trauma. And so looking at, you know, some of the reasons of why they're adopting, why they are agreeing to be placement. And granted, that goes back into the loss and grief as well as, you know, are they not able to have children of their own? Is there an infertility issue? So is that is that part of the reason they're adopting? And so, you know, are they mourning the loss of having their own children? And so obviously, you know, being in this field, we know about trauma, but definitely not negating trauma in this whole entire thing, because while yes, it is a good thing for children to be adopted and to be placed, it can also be very traumatic for them. And I think a lot of times we look at adoption as this awesome positive thing, but it can also be hard for them. And so we definitely want to make sure that we're looking at those things with the child. And then I definitely want to touch on privilege. As a Caucasian woman coming up into this area, and this is me being vulnerable, I definitely had to learn a lot, you know, especially in the climate we're in today. But I definitely want to be aware of there are clinicians, counselors, there are professionals in our field who have a white savior complex. And I do think that NTI goes through and has a number of really good and helpful articles, and has a really good section about talking about race, talking about ethnicity and diversity. I know she brought up, you know, and I think it's module 6, how low a number of us scored on it. And I think it was a very important aspect for me to step back and take a look at, especially moving into an area that I am the minority here. And the fact is that I need to respect the people that I'm coming from, and I need to be able to advocate for the clients and the children that I'm working with, especially as they're moving into adoptive families, because most of the adoptive families, kinship, guardianship families that I'm working with were white, and these were Alaskan Native children. And so making sure that, you know, we are balancing that and we are paying attention to them. I think as clinicians sometimes, and jumping down with professional privilege, we come into this field and we come into these things. I'm educated. I know what I'm talking about. I don't know what I'm talking about half the time. And I think that the NTI really helped me realize that and recognize that, you know, yes, I have a master's degree. Yes, I'm doing this, I'm doing that. Yes, I am honored to be here to be presenting to all of you right now, but I am constantly having to learn every day. And I came into this training not being competent in adoption, not being competent in recognizing my white privilege at times, not being competent in recognizing my professional privilege at times. And, you know, I think at times that can really damage our relationships with the families. And I know that there was a number of, in the NTI thing, it talks about, it has feedback from families. And so it talks about what families want and everything. And it talks about how much that not competent, adoptive competent counselors can harm the relationship, can harm the families. And, you know, saying things like, well, maybe this isn't what you signed up for, maybe sending it back in. And that can create that trauma cycle for the children. And so making sure that we are aware of our own bias, that we are aware of our privilege, and that we are actively working to combat those things, and that we're working to empower the families that we're working on, that we work with. Those are really important things. And so those were the 4 major things that I took from NTI, and that definitely have helped shape my practice, hopefully for the better, for the families that I serve. So thank you.
Wow, Courtney. First of all, thank you for sharing. I mean, obviously, what you learned from NTI, but even just being able to acknowledge what you didn't know. And I think that's obviously the first step for any of us in learning. And, you know, when we shared, you know, with you all a few minutes ago, the findings from our pilot, you know, we're not trying to shame people. We know that there are people who don't understand what they don't know. And so what we're trying to help people really do, and I think what you sort of reflected is, you know, this is pretty comprehensive training. It's 30 hours, right? And there might be pieces that you grasp onto and others that, you know, aren't quite there for you yet. But I really appreciate you sharing the pieces that really spoke to you and your work, and in particular working in, you know, a Native community where you know that there are barriers already. Even if you did know all of this stuff, there would be, you know, this stuff, there would be barriers for you. So thank you for sharing that. And if I could just ask a brief question. So you said that the area that you were working is roughly the size of Michigan. Do you know like what the population is for that area too? Do you, any idea? I'm just trying to think. Is it very remote in terms of people sparsed out throughout?
Yes, I know that the town that I'm in is a hub for the rest of the villages. And so the town I'm in is about 4,500 to 5,000 people. And then we have, oh goodness, actually, I had just looked it up. I'm sorry.
I was just trying to get a sense. It's not like Detroit. It's not like Michigan. It's
oh, no.
Very rural.
No. Yeah. But there's different villages scattered across the North Slope. I don't want to give numbers because I don't want to misrepresent it all.
No,
I should have been better prepared for that.
No,
Sorry.
No, that's okay. I was just in my mind trying to get a sense of, but it sounds like when you say remote, you're serious. It's very remote.
Yeah, some of the villages, the only way in or out is by plane. We are lucky that we do have that alternative that we can bring in supplies. We drove her truck up the ice road. So when you watch like the Dalton Highway or the Netflix series, that's one of ours. And so like we have to cross the tundra to get to here and everything, but mainly it's only by plane that I can get in and out.
Wow. All right. Well, thank you so much. And folks, if you do have some specific questions, just know we'll have some time at the end to ask questions, and you can put those in the chat. So thank you again, Courtney.
Thank you.
Our next speaker is Bonnie Goodwin. Bonnie is located in Oklahoma. And I mean this in the very best way possible. Bonnie was very persistent in her in pursuing NTI training for the folks in Oklahoma, and we're certainly grateful for her collaboration with us as Oklahoma became one of our pilot sites. So Bonnie also just recently received her PhD, so congratulations, Bonnie, on that. And I'll let you share now.
All right, thank you, Dawn. Yes, it's a wonderful beginning to our friendship, and I'll share a little bit about that. First of all, I just want to join everyone in saying thank you, Courtney, for sharing your perspective and your experience and everything that this journey has meant to you in so many ways. I do think that, as Kathy said in the chat, that humility is such a huge piece of this process. And I think sharing some of my story with NTI will highlight some of that as well, whether you want to be humble or not. It's just the reality. So I have worked in the field of social work for almost 20 years now, in several different ways and different venues. I've worked in criminal justice with children and families. I've worked in prevention services and in case management. And then when I went back to get my MSW is when I really was introduced to the work in adoption. And I will say, I'll just put in there too, I'm not an adoptive parent myself, but my mother-in-law was adopted from Oklahoma foster care. So she shared some experiences and what her experience was like as well. So when I was introduced to the work of adoption, it was pretty immediate, the difference between what most people think of when you think maybe as a student and you're trying to think of what field do I want to work in, especially in social work. It's so broad. There's so many different things that you could do. So often whenever we say adoption is an option for a field to work in, most of the time the first reaction is, oh, that's so fun, that's so happy, which is true. There are some beautiful, incredible things about adoption. But once you start working in the depth and walking through the journey and the process, you realize the complexity and just the broad range, like just what's on this slide, the broad range of different knowledge, different skills, techniques, understandings. And I think really what Courtney did such a great job of highlighting is the values that we need to really center and focus in when we are serving this population. So I started as a field placement, working with birth mothers as they made the decision to place their child for adoption in an agency in Kansas. So shout out to Kansas. I saw someone was here from Kansas, and learned a lot, really helped me, gave me the introduction to the complexity and the breadth of what was really needed. Then I moved to Oklahoma and took a job in another adoption agency. But within this one, over a couple years of work, it really came apparent to us in this agency that there was a need for this specific type of mental health. So I didn't even know the research that Dawn and Lisa shared with us earlier from the American Pediatrics, that was the greatest unmet need, but we knew it, we heard it, and we felt it when we were serving adoptive families and adopted children and all members of the triad, so all of the biological families that were connected to our agency as well. So I was then tasked with the long journey of trying to shape and build a specialized counseling center for children and families, like I said, all members of the triad, from adoption and foster care. So as I had already been introduced to this really broad range of the complexities and all of the intricacies that we needed to know, as I started digging in to try and understand, okay, what treatment modalities, what certifications do we need to get some of our practitioners trained in? What do I need to be trained in? What training, what other webinars, workshops, all these different things. And that's whenever I really, when I started hearing about NTI. So real quick, before we go to the next slide, like I said, we had been hearing the experiences from our families and from our kids that we had been working with, because one thing about the agency that I worked with that I appreciated was they considered it to be a lifelong connection. It wasn't just here, the adoption is completed and finalized, so therefore go off and be happily ever after. But they had an awareness that this was a lifelong process. And we continued to hear from some of the families that we worked with, some of the things that Lisa was mentioning earlier, that there are other professionals in our area that would say those exact words that she said, that this seems too far out of the range of what we can do. I think your best option is to return the child to foster care. And that's just, it's painful for the families and the children to hear that, but then also for us as professionals who really believe that there are other strategies, other tools, other ways to be able to support children and families within adoption. Okay, next slide. Okay, so it was whenever I went to Nashville, Tennessee, on this search for trying to understand what all do we need to be in the realm of best practice, of being able to be a truly specialized counseling center, to be able to provide the best top-notch services for our children and families. So I was in full search mode, which is why I got very excited whenever I sat down and listened to Dawn and others from C.A.S.E and NTI start sharing about this curriculum. And at that point, it was in I think it was year 3 of the 5-year process with the federal grant. And they were just getting ready. They had already identified state sites, and had given us a little bit of a glimpse, kind of a sneak peek of what the NTI webinar training was going to look like. And I felt so just drawn to it, and it was exactly what I was looking for and what I needed myself, because I knew there was, just like what Courtney said, when you start to scratch the surface and you start to really dig into this, you realize how much you don't know. And it's overwhelming and it's humbling. And so I was in that place of, I need something to help me. I need many things to help me understand all of this, but this NTI it was like gold to me. It was like this opportunity that put all of these things, and it was so broad, into one training. And so, yes, I became very persistent, and I went up to Dawn after the training and I was like, hey, have you thought about Oklahoma? I think Oklahoma would be really, really good for this. And so Dawn was gracious enough to continue conversing with me. And I believe it was out of luck. In the next few months, we were then able to join that pilot. So as we started talking about that, I had some connections to some of the leadership within child welfare in the state. And I started sharing some of my thoughts, because in our agency, the counseling center that we were building was not just meant to be for the families that had gone through the adoption process from the agency, but we were also collaborating and connecting with the child welfare agency across the state and trying to help them understand what services needed to be provided. So in those conversations, the interest was contagious, and they agreed that this sounds like something that would be really, really helpful and needed. I will say Oklahoma really has a history of jumping on board with a lot of very great initiatives, which does two things. There's one, the good thing of, we have a lot of good knowledge and some good training. I would say a lot of our child welfare staff and professionals have some good awareness of trauma. There was a really big push and initiative before NTI to know trauma-focused interventions. What does it mean to be trauma aware? So there's a good strength of trauma, but that's just one piece. And that's really what my conversation was involving when I was trying to explain to child welfare why NTI was the next best step, is that we have pieces, but we need a broader foundation and a broader framework that's going to include, what does that mean with loss and grief and the separation? We know those are traumatic. What does it mean specifically for adoption? And then as we were looking at some of those modules, attachment, and then identity formation, and I'll talk about those here in a minute. So when we joined the pilot, we were very excited. And we did the child welfare pilot first, and that went pretty well, because it's a more of a system that's structured. We have a statewide system. So it was a little easier to be able to structure that pilot rollout and kind of regulate it and keep track of it. When we shifted into the pilot phase of trying to reach out to mental health providers, it's a more challenging process to try. Mental health is a little more independent. There's a lot more potential silos across your state. And that's kind of how we were. We have some community centers that would directly contract with child welfare, but then there's also a whole host of private practice. The specialized center that I was working out of would be considered a private practice. So what our dream was and what our thought was is that we could launch this thing with a conference, the first time ever, to bring child welfare professionals and mental health professionals in one place. And we did two of them, one in Oklahoma City and the other in Tulsa. And we really just wanted to launch the story and say, here's what NTI is. We're at the tail end of the child welfare pilot. So we had some great panelists giving some good feedback about what they learned going through the NTI pilot, and then shifting into mental health professionals in our audience. Here's what's important. Here's why this is so needed. And it was an interesting conversation to be in the midst of as a mental health professional myself, of hearing some who jumped on board immediately of, this is what I've been looking for. This is what I know that I've needed for so long, and I'm so excited, sign me up. And then we had some who had been working for 10, 15 years and felt a little, I don't want to put words in people's mouths, but it was a little bit hesitant and resistant maybe to the sense of, I've been doing this a long time and I've had good results, right? So what else do I need to know? And how do you know that I don't know it since I've been doing this for so long? So immediately I picked up on this, that sense of there's a dynamic within the mental health that's challenging of no one gets into this job to not do a good job. All of us have the desire and the drive and the motivation to help and to do good for our families and our kids that we're serving. And so to hear that message saying you might not have all the tools yet, it depends on where you're at, right? It's if you're looking for that and you already know that, then this is a great response. But if it's a new message and you start to struggle a little bit with that feeling of like, okay, have I done the best in the past? Then it can be a challenge to process through, which is why I think that piece that Courtney shared of that humility is a really big key to understanding adoption competency. Okay, next slide. Okay, so we'll be on this slide for a minute because each of these are kind of like big pieces, bricks to the foundation, I think, of how it's changed me, how it's changed practice within my own mental health practice, but then also now I work with the state as a statewide coordinator of adoption preservation services. So I'm meeting with mental health professionals all the time, talking to them about the importance of adoption competency and hearing back from them as they finish NTI. And we also have the TAC training in Oklahoma, the training in adoption competency that Dawn mentioned earlier. So meeting with them during the completion and after the completion of TAC as well, and hearing this depth of what does it mean to you that you have gone through these trainings and now what's different about you. So this first one, I think, is one of the top things that we hear from mental health providers. It provides, it not just provides, it pushes you to this really in-depth awareness of what intake and assessment needs to look like. And one of the things that I love about the NTI training is that there is actually a intake, adoption competent intake that is a resource that's provided to you as a practitioner that you can use that helps you pinpoint some of the things in the history of the child, history of the biological family, history of the adoptive family. There's a lot there that we don't always automatically take time to gather that information at assessment and intake. But it's really critical and it's really important to us to understand how to enter into the dynamic of the adoptive home, but also maybe what may be some of those areas that there has been exceptional levels of pain or trauma or unresolved grief from all sides, because grief touches everyone in adoption. So a broader understanding of what is it that we need to know, what do we need to learn, and what do we need to hear and process from the child and the family at intake, so the very, very beginning. The second one is actually one of the most dear to my heart, is of value, I feel like, that has really been strengthened and given some structure for me through the NTI training, is the understanding of the role of biological families. So often in adoption, we focus on the child and the adoptive family, which is so important because there's a lot to do there, and there's a lot of attachment and grieving to process through. And I mean, the child's living in that home, so there's a lot of things to process there. But the role of the biological family sometimes gets lost in the processing. And I will admit that I think that was one of my weakest areas, was understanding the importance of honoring and respecting and being able to converse and help create an environment of open conversation in the adoptive home about biological family members. I think one example of when this really became real to me was when I was working with a child who was initially internationally adopted. So we didn't have much information at all about her biological family. We knew just pieces, and many of those pieces had been told to her in a way that was, I would say, is not adoption competent. It was the sense of kind of like what Courtney was saying. Here's, be grateful that you are where you're at, because this is, you were left to die. You were left in a field by yourself. But once I started really digging into understanding biological families and the role that's the critical role that they play throughout the life of the child, the adoptive mom and I started processing this in our own. She would have some sessions by herself to process through this international adoption. And we talked about, it's been such a painful thing for this child to hear such a negative story about her beginning, about the reason why she was placed into an orphanage and then adopted internationally. And so we started talking about the importance of actually giving her this better full picture of, hold on, you were placed, yes, you were placed in a field, but you were found. You were placed in a part of the field that someone knew you would be found. And so the narrative shifted, and the narrative changed with this knowledge and respect and an understanding of biological parents who have to make tough decisions to care for their children. And really the beautiful thing is that when we started talking to the child about kind of looking at the different angles of what does this mean for you? And man, you were loved, you were cared for, maybe in a way that is really painful and doesn't make sense right now to you, but here's a different angle than what you've been told. And that really shifted her perspective and helped her as she was going into adolescence. And we know that in child development, that adolescence, which I'm going to this next line here of adoption and development, we know that identity formation in adoption is so critical. And the role of the biological family plays a big piece in understanding how to support an adolescent adopted child in putting the pieces of the puzzle together to understand, who am I? And so it really was something that was critical to support her process and helping her put the pieces together of, actually, I am worthy. I am worthy of people's care. I was worthy. My mom did love me. It was just different, and it was hard, and it was painful. And so it shifted and gave her kind of a foundation to be able to start building this identity of putting all of these pieces together into a whole, and giving her some positive connection with that. Okay, so adoption and development. I think that's another piece of understanding the complexities between adoption and development. Really has kind of a trauma piece to it as well, of that the journey of a child who's been adopted is not something that there's just one time when they talk about their adoption experience and then it makes sense and they feel okay, and so now we're going to be happily ever after. But it's a process where the child is continuing to develop and their brain continues to develop. And I consider it, I learned this from the NTI training, that as the brain continues to develop, it's like a new pair of glasses, a new perspective of their own story that they're putting on especially at the big milestone ages of brain growth. 8 years old, 12 years old, 15 years old, new glasses. And when those new glasses go on, then it's almost like the experiences, it's a rehashing of some of this painful experience in the past. Maybe the trauma comes back, maybe some of the sense of abandonment or rejection, and emotions and behavior starts to rise again. And this can be really overwhelming for adoptive parents who don't have that understanding of this is a part of the journey. It's normal. It's a part of the process of this developmental trauma, this adoption journey. And it's okay. And not only is it okay, but it's actually really good, because the more times that you are able to be supportive of this child who continues to process, who am I? What does this mean? What is my history? And put more of those pieces together and continue to experience the emotions and the behavior in a safe environment that understands it and supports it, then that not only supports that attachment, but it also, it supports the whole family unit. So understanding that complexity, I think, is one of the top things that I talk about with mental health providers across our state, as well as child welfare professionals, to then help in those conversations when parents are calling saying, I don't know what happened. I thought we were doing well. It's not good. I feel like I'm failing. What have I done wrong? And so we can have that conversation of being able to talk through, okay, how old is your child? What does that mean? What might your child be processing right now or reprocessing? And how can we support you? And how can you support your child?
Bonnie, excuse me for interrupting.
Yeah.
We had a question that I think is appropriate to ask right here
Okay.
from Olivia in Nebraska, I think. And she asked, did Oklahoma implement specific strategies for evidence-based practices for older adoptees based on your NTI work?
Great question. Yes and no. I will say yes, because I think it definitely helped leadership to identify, because that's one of the beautiful things about the NTI training as well, is that, as they've stated a couple times in this webinar, it's not a training where you're going to be certified in EMDR at the end of it. But what it does is gives you a large range of understanding of all the different evidence-based practices or evidence-informed practices that are effective and that are helpful in for adoptive children and families. So it helped our leadership be able to identify what are those things, what are some of those certifications that we want to make sure that we see as a certification for those that we refer to, specifically from our foster and adopt departments within the child welfare state system, as well as the post-adoption. But then it also gives us the chance to, like many times I will jump on a webinar or jump on a Facebook Live with the Foster and Adoptive Coalition here in Oklahoma. So I'm talking to parents and I'm able to tell them, here's a huge list of all these different potential certifications, modalities that we know work really well with this population. So they can then advocate for themselves. I will say, why I say yes and no is because I do think that's one of the things that we're working on with the mental health community in particular, is really strengthening the understanding of what adoption competency is and identifying what are, so like whenever I was saying this whole thing began with me on a search for what do we need to be trained in. It did help us in the specific counseling center that I was talking about. It helps us identify about 5 specific modalities that we identified in our agency that we wanted to be trained in. And we started the process of funding and getting our staff and our practitioners trained and certified in those things. But I think it's across the board, it takes a long time to do that across the state. And some of those ways to do that is to help professionals and parents really advocate so they know exactly what they're looking for in the professionals that they're seeking and interviewing. So I hope that was a good response to that question. Okay, so
Bonnie?
Yeah. Oh, okay, yeah. Sorry, Lisa. The 4th, highlighted the need for specific tools to help children grieve multiple losses as well as work through attachment. Those are 2 of the other things. If I could identify kind kind of the top two conversations that I have most of the time with families and with professionals, mental health professionals, is attachment and grief and loss. Those things are just top of the conversation all the time when we're talking about serving adoptive families, adoptive children, and biological families in the adoption triad. And so, and it's not just an awareness and an understanding, but the really important thing about NTI and what I keep telling mental health professionals that I'm working with is the training itself has actual resources that you can learn about and download and use. They're free resources. And so that's a huge benefit of specific schools, tools, practical things that you can do. And it actually, we turn that around and utilize some of that training and those resources to help create kind of a guide for child welfare staff to be able to use whenever a child is transitioning from one home, like a foster home, to another one, or a foster home to adoptive home. Any transition, the one I'm thinking of specifically is the goodbye letter that we talk about in the NTI training and curriculum. Being able to utilize something like that that's really specific and concrete, and that's been really powerful for our professionals across the state to be able to say, here's something that we can utilize now, and not just an understanding of grief, but a tool to be able to actually start working on. Okay, and then the last one here is really, all of these are important to me, but the last one's really a part of my heart of NTI as well, is spurred practitioners to realize the need for systems collaboration and our role in facilitation. So often, well, with adoption, I'm a social worker at heart. And so I look at clients and people that I work with as a person in the environment that they're in. So all the systems that are interweaved in their life and have an impact on who they are. And that is really the systems perspective with NTI, is understanding that we are not just working with a child, that we're working with the child in the environment of the family. And that family is connected to the biological family. And all of them are connected to the state or the legal system that has finalized the adoption. And then they're all also connected in some way to the school and the medical, with pediatric, all those things. So there's so many systems that are important and critical to understand, and have, again, specific tools of how to collaborate within them, understand the interweaving, and then be able to facilitate good communication, understanding, and work between all of those systems for the good of the child and the family that you're serving. Okay, next.
Bonnie.
Oh, yeah.
No, I was going to say, wow, Bonnie, that's wonderful. Oh, you've got more. Sorry about that. All right, we got to give you a few more minutes because we do have a few other things we want to get to too. So just a little reminder.
You got it, Dawn. I'll wrap up. So yeah, real quick at the end here, on that note, what we're working on in the state is really trying, is what I was mentioning earlier, trying to build a network of mental health providers to be able to strengthen this understanding and support each other and collaborate with each other, share tools, share perspectives, work on crisis intervention. That's one of the biggest challenges and gaps, I think, across our whole nation, of how do we, in those moments of crisis, how do we get in and work to solidify and strengthen the family. And another key piece in Oklahoma is really understanding how to network between rural and urban, because we've got so many services that are provided in the big city areas that are not easily accessed in the rural areas. I think I have one last thing. I've touched on all these. These are all the major benefits that I see of NTI, but I've talked about them in other slides. So we can go on to the next slide with contact information, and we'll turn it over to you, Dawn.
Great. Thank you so much, Bonnie. I've been immersed in NTI now for almost 6 years. And every time we do one of these webinars, I get more excited because I hear what it does for other people. And I know it's worthwhile. Obviously, I love NTI, but to hear people and how they use it in practice and how it informs and changes their practice is so powerful. So thank you, Bonnie, for being a champion, certainly in Oklahoma. And again, thank you to Courtney for being a champion in Alaska. And I think you can count on us reaching out to you all again to help us. So thank you guys for sharing your wonderful information with us. So for those of you who do take NTI, we do have, a couple benefits, if you will, in terms of what you can get beyond the knowledge, skills from NTI. One of them is that we can add you to our searchable database. This is the National Directory of NTI trained professionals. So when folks come to our organization and they want to know, is there anybody in Kansas, who's adoption competent? Well, we can't specifically say that you're adoption competent. We can say that you have been trained in this particular curriculum. And that can be a huge bonus for families who are really looking for folks who sort of understand their needs. And even just from what we said earlier on, that's a struggle for many families in many parts of our country for sure. And you can find this directory on our website. You can go to adoptionsupport.org/NTI and you'll see at the top, it'll be the national right here, NTI directory, the right-hand side of the screen at the top here. All right, next one.
Yep, so there are a number of ways to access NTI. We're going to just drop the link into the website, into the chat box, so you can see what that is. And it's very simple, people. It's really simple if you're an individual and want to log on and start NTI. You can do it, as soon as we get out of this webinar, if you like. And if you're an agency or an organization that would like to integrate NTI into your training milieu, contact us and we will help you with an implementation plan to do so. And again, it's free. We say it's free. And it was funded by the Children's Bureau. I was on a call earlier today where one of the gentlemen who had participated in NTI said, it's free, but it wasn't just, pulled out of the air and handed to us. It was funded by the Children's Bureau and over a $9 million grant to date. So we are, it's very high quality. I think Courtney and Bonnie, holy cow, you guys are the best cheerleaders that we have, and really appreciate your time. If folks have any questions, put your cameras on so we could see you, Bonnie and Courtney. Yeah. And if you have any questions, I think that Bonnie and Courtney would be happy to answer any questions that you do have.
Well, let me just real quick, somebody had asked, does this directory refer to people who have completed the TAC training in the past? There's actually already a directory of TAC trained professionals. So we actually have two different directories, one for NTI and one for TAC as well. So if you're a clinician who's completed either one of those trainings, depending on which training, you could be in that directory. And then I just want to also add, when we talk about access, so if you're an individual and you want to take the NTI training using our learning management system, you can access it. But if you're part of an agency system, if you are in a state and you want to bring NTI to your state the way, say, Bonnie did in Oklahoma, then we do want to work with you. So please reach out and let us know. And folks should be also getting copies of this PowerPoint as well tomorrow, I believe. So just wanted y'all to know that. All right, any specific questions? Have they come in? Have we had any? Know that we have. I know some folks asked for.
No specific questions other than what we've responded to previously.
Thank you, Edna.
Well, we have a message from Laurie Levine who says, also an NTI cheerleader, took it on my own and was very impressed.
Thank you. Spread the word.
Yeah, spread the word. We've probably had almost 17,000 professionals across the country enroll in NTI. They haven't all completed yet. That's both child welfare and mental health. So we have one question, is TAC different than the NTI mental health track? So yes, that's a great question. So NTI is a fully online web-based training. It is about 30 hours of curriculum, excellent content. The TAC training is an instructor-led training, and it is a 72-hour curriculum that's usually spread over about 12, what we say in person, could be virtual, in-person live sessions. And because it's 72 hours, it is much more in-depth clinically, and it also includes case consultations as a part of the training. And TAC is also an accredited training, so it's what we call an assessment-based certificate program in adoption competency. So there are two different trainings for folks.
Yeah. And while we've got people on here from around the country, I will put that plug in. We are really trying so very hard. Our focus in the last year has been to engage more mental health workers across the country. And, if you work in that arena, you know that there's not sort of a central mental health organization that helps us connect with folks across the country. We're really interested in reaching out to people. If you know of anyone who may have an interest, if you know of any leaders in any of your states in the mental health arena, we would be thrilled to have a conversation with them. And if you are, if you feel like you're comfortable enough making an introduction, we would appreciate that. And if not, just maybe pass along some contact information to us. Our information is going to be here at the last slide. And then we've got more webinars coming up. We had a whole series of Transfer of Learning Tuesdays. Here are the next ones coming up: June 15th, July 13th, August 17th, and September 14th on a variety of topics. We're happy to get input, happy to get your questions, happy to get your feedback, and you will be getting a survey at the end of this as well. Yeah, there you go. Gary's always on top of that for
Lisa,
us.
I don't know if folks can read the slide real quick. Can you go back real quick? So the July 13th is focusing on attachment and loss and grief, so content from those modules. The August webinar is focusing on race and identity formation. And then the September one is promoting family stability. So if those are, hope you join all of them, but if those are of particular interest to you, we want to invite you to those as well.
Dawn, this is Edna. There was one question. Bonnie mentioned broadening the understanding of the role of biological parents. Does NTI training feature the voice of biological parents? For example, videos with their voices and stories, etc.
That's a great question. I'm trying to think if we have specific video clips of biological parents. And off the top of my head, I can't remember. We have a whole lot of videos and video clips from folks with lived experience. So that may be more from youth. I don't know, Bonnie, can you remember?
I thought so.
I was thinking we did too, but I do know even when we don't necessarily have like a video clip, as Bonnie mentioned, there is a lot of content around, that when children are placed with a new family, they don't forget their family. They don't forget the people who were important to them. They don't forget whether it was multiple foster homes or birth family or whoever it is they've lived with. Those people are still a part of their life psychologically, if not physically. And I think one of the main learnings from NTI for a lot of people is that understanding that children aren't blank slates. They don't come to you blank. They come to you with all of their, history and their grief and their attachments and, all the things that are important to them and their losses. I mean, it's positive and negative, right? There's a lot going on there. And as adoptive families or as kinship, guardianship families, as foster families, it's our job to help them continue to stay connected and to honor those connections in whatever way we can make that happen. I mean, maybe they can't live with those people, but that doesn't mean they can't have some connection. And the same would be true for culture. And I think Courtney spoke beautifully, to that it is our job to make sure that we are honoring culture for children and race and ethnicity, and that we're being very intentional about keeping those connections for children where we can and where it's safe. And sometimes it means we have to dig really deep and we have to be very intentional and persistent to make it happen, but that's part of our task. as professionals and as parents who have these children in our families. So I know our time is up. It's 3:30, but just know that there are so many nuggets in NTI. Our hope is that folks will embrace NTI training so that they can do the kind of work that all children and youth and families, in the foster, adoptive, kinship, guardianship network deserve. And if we can help you in any way to make that happen, please reach out to us. And thank you so much for joining us, and thank you for wanting to learn more about NTI. And thank you especially to Bonnie and Courtney for your willingness to share about the impact of NTI in your own work. So thank you.
Thanks so much. Thank you, everybody. Have a great day.
And finish the survey, please.
Finish the survey and get in touch with us.